At the outset, I want to put on the record of the Dáil my appreciation for the work undertaken by the Chief Medical Officer, Dr. Tony Houlihan, and the Acting Chief Medical Officer, Dr. Ronan Glynn, in respect of the COVID-19 pandemic. We are indebted to them for their calm and wise advice and their expertise at this very difficult time for everyone. Just in relation to the pubs, in the past I have strongly supported the enactment of the Public Health Alcohol Bill 2015. I am very much aware of the harmful effects of alcohol on our health system and on society in general. That said, it's very clear that publicans have had a very difficult time since March, and I fully appreciate the struggle they are engaged in to keep their businesses viable. We have seen during the course of debates earlier today that publicans are well represented in this House by the rural independents and others, and they don't need me to champion their case. But it is obvious to me that it is far better at this time for people to be drinking in wet pubs where strict guidelines are in place than drinking out at alternative locations such as at house parties, etc. I welcome the fact that the wet pubs will now be treated like any other businesses and that they are scheduled to open on September 21st. The pub is the principal social outlet in many rural areas, and social isolation is a key issue. However, I need to qualify this. I'm very concerned about the amount of COVID-19 cases in the Dublin area. We are told that things are on a knife edge. If it emerges that the opening of the wet pubs have been responsible for a rise in outbreaks of COVID-19 cases, then we should not think twice about closing them again on a county-by-county basis in the interest of public health. The decision to open on September the 1st must be kept under constant review. COVID-19 has had a serious impact on the mental health and well-being of almost every sector in society, on children, on teenagers and young adults, on those with disabilities and their parents, on workers and those who have lost their jobs, on older people, just to name a few sectors. People are facing huge uncertainties about their future at this time. In my role as a public representative, I have never before seen such high levels of anxiety and stress in our communities. We really do need to make mental health a priority going forward. In this regard, a mental health reform representing 70 different organisations have launched their pre-budget submission. Because of COVID-19, this is the year to make a real commitment to developing our mental health services. The sector was in crisis before the onset of COVID-19, but adequate investment in mental health services must be an absolute priority from here on in. I welcome the news that the Government's medium-term plan for living with COVID-19 will be published next week. I would ask the Minister to give serious consideration to allowing a greater number of spectators at outdoor events in this context. I certainly think it is possible, given where we are just now in this regard. I also want to welcome the fact that clarification has been provided by the Minister that drug and alcohol support group meetings can continue to operate subject to adherence to public health guidance relating to physical distancing and other protective measures. AA meetings are a very important part of our health service, and I'm delighted that they can proceed. Just to conclude, we've heard a lot about opening our economy and opening our society, but we now need to rebuild our economy and rebuild our society, and a lot of work has to be done in that regard. Thank you.